Hi, and welcome to the Restorative Wellness Clinicians Corner, video series exclusively for functional health professionals, where we interview the top experts in the latest research, products, tools, and best practices for getting your clients exceptional results. Welcome back to the Clinicians Corner. Today, we are diving into a topic that touches so many of our clients, bone health. But we're going to look at it today through a deeper and even more holistic lens than we've talked about it in the past. Our guest today is Margie Bissinger, a physical therapist, integrative health coach, author, and happiness trainer. And we're going to dig into that more, let me tell you. Margie has over 25 years of experience helping people with osteoporosis and osteopenia improve their bone health through a comprehensive integrative approach. She hosts the Happy Bones, Happy Life podcast and has hosted 4 summits on natural approaches to osteoporosis and bone health. And I have had the honor of being on the most recent one. In addition to all of this, Margie oversees all the osteoporosis initiatives for the state of New Jersey as a physical therapy representative to the New Jersey Interagency Council on Osteoporosis. She's lectured to Fortune 500 companies, government agencies, hospitals, and women's groups throughout the country. She's been featured in the New York Times, Menopause Management, OBGYN News, and contributed to numerous health and fitness books. And little fun fact, Margie and I met at my very first Mindshare Leadership Summit back in 2017. Was that your first time too, or had you been there already?
I'm trying to think. I'm not sure if that was my very first one. I've been going so many times. Yeah.
Well, Margie, welcome. I am so excited to have you here and to dig into this super important topic.
Well, thank you so much for inviting me. I'm really thrilled to talk to the practitioners and everybody in your community, because I really believe that you're the people that can make such a difference. And it's exciting for me to share so that everybody can really, really improve people's lives.
I love it. And I agree so much. Now, I really want to dig into your background because you bring this really unique blend of, physical therapy, integrative health coaching, and then happiness training, which is like not something that we see this combination very often. So how did this background bring you to this place where you're focusing on osteoporosis?
Yeah, it's so crazy. Way back, I mean, I've been doing osteoporosis for 25 years, but I've been a physical therapist for over 40 years. So early on in my 20s, I was working as a physical therapist in Chicago, and I hadn't gone through a hard time in my life. And I'm working with chronic pain patients, and everyone's like, Margie, you're so happy. Like, what's your secret? And they were truly miserable. Like, each person was more unhappy than the next. And I thought if they only knew what I had just gone through, they really wouldn't be saying this. But then it hit me one day that, you know what? Despite my circumstances, I actually was happy. And that my happiness wasn't dependent on my circumstances. It was sort of an inside job. And what did I do that I am doing okay, despite what had gone on? And so I decided, okay, now I call them happiness habits. I didn't know at the time, but I started teaching them because as a physical therapist, you have time. You're working with patients, you're working on their muscles. So I said, what the heck? I started teaching them some certain of the things while I was working on them, what helped me get through things. And miracles started happening. Chronic pain got better so much faster than with conventional therapy that I thought, oh my gosh, there's something to this. And so then I started studying positive psychology. And then I really learned how to teach happiness with a mentor, Marcy Shimoff. But really since then, I mean, this is over 40 years, every single thing I do, I incorporate happiness because I really see it moves the needle. And it's something that really helps overall to healing. So that was that. Then around 25 years ago, I'm working in orthopedic physical therapy, and I was with a group of doctors. They started sending me their osteoporosis patients, and I had special training in this, and I couldn't believe everybody, well-intentioned people. Now, this is before the internet even, where they were doing exercises that were increasing the risk of fractures. And that just made me so upset because they didn't know who to turn to. They're just looking at books or fitness instructors or the gym. And so that's when I said, I really have to get involved with this. And so that's when I started getting involved. And I just took all my happiness and stress reduction and added that because I knew from my other work how important it was. And this population, I have to say, is very high stress because, cortisol and stress really contributes also to bone breakdown. So it all sort of goes together. So that's how I got into all of this in osteoporosis. And now it's, over 25 years with the osteoporosis.
That's fascinating. I think that mindset piece, I love the way you stumbled into that. That's first of all, like such a great use of time, because you're right. Like when you're in PT, like there is time, right? You're sitting there doing your exercises, you chitter chat with, your either your patient or your practitioner, depending on which role you're in that moment. But I think that's fantastic. And I love the way you just saw firsthand how that just dramatically improved clinical outcomes.
And it's just amazing. Even the better part of that was, people, I just don't believe we just sort of should get by. And how you doing? I'm okay, getting by. People are really meant to thrive. So what I started seeing was their eyes lit up and they just started they felt better also. So it all sort of went together. But, just that happiness piece when they're focusing on things that are working and just a different way of living, all of a sudden, you just see a different person emerge, and it's a much healthier person and someone that's going to navigate life in just a much better way.
I love that so much. Now, I'm really intrigued by another thing that you said is that they were doing all the wrong things that were actually increasing their risk of bone fracture. Can you give us a teaser? And is this the kind of thing that they were getting from like other conventional medical models, or is this just they were misunderstanding? Can you give us an idea?
Yeah, I'll tell you. I'll tell you exactly what I was seeing.
Yeah.
So the biggest deal, and what I see so often, is forward bending and rounding of the spine. And so what happens, I actually have a spine here. I know most people aren't watching, but but anyway, it's the front of the spine for anybody that is. It's the front of the spine where the fractures occur, mostly in the thoracic, in the middle of the back.
Okay.
And so, a lot of people you see touching the toes, doing windmills, all of these things. So they did a study at the Mayo Clinic, and they looked at people over a 6-year period of time, only seeing fractured incidents with people with osteoporosis doing certain exercises. And so they found when people were doing extension, which is backward bending, they had a 16% fracture rate. People who were only doing like sit-ups and rounding, 89% fracture rate.
Oh my gosh.
Yeah.
Crazy.
The control group was much less. But the point is, it's the front of the spine where the fractures occur. And if we can see this, so a nice vertebrae, ideally it's nice and square.
Right.
But what happens with osteoporosis, and if there's any bone loss and any fractures, it becomes wedge shaped. And it's the front that has the wedge. So if you think of a wedge and now you're bending forward, all the force is occurring in the weakest area. So what happens is people are, sustaining fractures so people were doing toe touches and they were doing all these bending things, yoga. Not that you can't do all those things, but you do them with a neutral spine, maintaining the inward curve in your spine. It's called hip hinging. So that was the biggest thing I was seeing. And I know people who actually are a good friend's mother. She's no longer alive, but she had 3 fractures because she was at a treadmill and she went to a new YMCA and they made it lower. So she's bent over at the treadmill and that force, that fulcrum from being rounded. So I would say that's the biggest thing. And also, extremes of motion, extreme rotation and side bending. This is not what we want. You can go to full motion, but we don't want extreme. So especially, that bending forward and twisting like a windmill, all of those things you really wouldn't want to do, because not if you do it one time, but the point is that's what's putting more force on an already weakened area and can increase your risk of fracture. So they've never done that study again. They'll never repeat that. But yeah, so that's that. I would say that's what I was seeing. It just was so sad because people didn't have guidance. And that's what I see. People go to the doctor and they mean well. They really do. I am not faulting the doctors because they have so many things to do. And they'll say, do weight bearing exercises, or they won't really give details or even guidance on where to go. And, if people don't have the training, they really don't know. And so some people do, but a lot of times, or people see something in the research that this has worked, heavy resistance. We can talk about that later. And then they'll just go and try to do it. And then they really hurt themselves because they're not in a good posture. They don't know how to stabilize. So it's really important. And especially for any kind of practitioner, because this piece can make such a big deal in their overall health, to understand the principles, not that you're going to teach them that, but so that you know how to guide people.
Well, let's just jump right into it. I was going to save this for later into the conversation, but we're already
Yeah.
there. So let's just talk about it because I do hear that. We all know. I think everyone knows at this point, like do resistance training. Like we're all
Yeah.
celebrating, you know, especially as we get older, don't be afraid to lift heavy. And I will, I'll tell you, because I do spend quite a bit of time at the gym, and, I see some people do it well, and I see some people do things that make me cringe. And so let's get a lot more specific than just like lifting heavy. So can you
Okay.
talk a little bit
Absolutely.
about
Yep.
how we want to guide them, and even
Yep.
like, because some of the practitioners here who are listening will be actually trainers. So they
Mhm.
might do this themselves, but a lot will be referring and helping their clients find referrals for somebody who knows what they're doing. Because this is very different from, the trainer working with the 25-year-old, or when they were at much earlier stages of things and not yet thinking, although maybe I'm thinking about this incorrectly. Maybe we should be
Yeah.
thinking about it a lot
Okay.
earlier.
So we'll
So much
back.
impact.
Yep. So let's go into this conversation.
Yeah.
Okay. So in terms of what they've really found work, very interesting. There was a study done called the Lift More study in Australia. And, prior to that, when people said resistance, the philosophy is that when a muscle contracts, if a muscle's contracting against a resistance, it's that pulling on the muscle and the bone, the tugging that's saying, hey, we need more bone here.
Right.
And so that's the philosophy, that the bone responds to the forces placed upon it. But the problem is, a lot of times people were doing, 2 pounds, 3 pounds. What is it that really moves the needle when we're thinking about bone density and really improving our bone? So they did this study, a woman named Belinda Beck. She's a PhD in Australia, and she did this very important study called the Lift More study. And what she did, she took women who had osteoporosis, had low bone mass, and they did it, but it was with supervision. So with physical therapists, exercise physiologists who were really trained, and they went through first training them how to lift, how to stabilize posture, all that, and then doing serious weight training. So doing overhead press, doing, with the weight on the shoulders, doing squats, weighted squats, lifting themselves and landing on their heels, and doing deadlifts. So serious weight training. And the good news was they had really fabulous results. So not only did bone density in the hip and the spine improve, but they actually found the geometry of the hip changed. So it protected the femoral neck, which is the area that's most prone to fractures. So it was really, really exciting. And so what happened with Belinda was that she said, all right, this was a study. Let's see if I can do it in the clinic. So then she started doing it, having practitioners train them and see what happens. And the same results. They're all increasing bone density, huge reduction in falls and fractures. I mean, unbelievable. Best research around. And this is the highest weight that anyone's done. So that pretty much made a big dent in what's possible when done safely. The key was it was done with supervision. So that's one. So now that's called Onero, Onero. I was really lucky because I interviewed Belinda for my summit and my podcast. And I said to Belinda early on, I said, is there anyone in the United States who's doing this? She said, one person who is trained. And that person was Dr. Claudia Tomas, who, I said, where is she? In New Jersey, 25 minutes from where I lived. So I called Claudia up. I said, I'm doing this. Anyway, so I've been doing it now for over a year, and it's amazing. I've gotten and I always did strength training and did machines, but this is a totally another level of, and it's amazing that everybody around me, and these people didn't start out as major exercises. We're lifting, but we learned how to stabilize, how to do everything safely. So that's one end. But Onero, you can go on their website. I guess if you Google probably Onero or the Bone Clinic in Australia, they have a map. And so that's something you can absolutely refer, because it's a wonderful program. It's taught by people who are really trained. And I just can't say enough good things. I mean, the people in my class are all ages. I would say probably maybe up to 75 even, but people are lifting major and they're feeling good and their bone density is increasing. It's incredible. So that's Onero. But so anyway, but what works, but everybody doesn't have to do that. What I would say for people, so that's one possibility. The other possibility is just refer to a physical therapist who has a background in osteoporosis. And there's a program called Bone Fit from Canada. And that program and I'm trained in that, and they really teach the therapist and even the exercise. Not everybody's a physical therapist, but anyone that's had that training has a really good background. So I made a easy thing. I like to do tiny URLs, tinyurl.com/ I think it's PT Bone Fit. I don't think it's Bone Fit. I think it's PT. Let's see, I wrote it down so I would remember it. PT Bone Fit. Yeah. And so, you can also go on the Bone Health and Osteoporosis Foundation website or just put Bone Fit, find a practitioner. But anyway, Bone Fit is a way to also find someone who's had it. Or you can also go to choosept.com for a physical therapist. And then you would write in when it says specialty, geriatrics or women's health. And then they can call. Is there anyone that specializes in osteoporosis? But back to what you were saying. So we want to do resistance. And in terms of repetitions, in the Onero, we do 5 sets of 5 repetitions because it's like 85% of 1 repetition max. But in general, you may not start there.
Right.
You can start 10 to 12 repetitions, and usually around 8 to 10 is effective, but it's not doing 50 repetitions. It's doing fewer repetitions, and it's the weight that's really making a difference. And like squats are so fabulous, lunges. So that's really important for strength. Doing a lot of upper back strengthening, core, all of that has been really up on your toes. That's great. Impact. Not everybody can jump, but people can go up on their toes and down on their heels. And actually in the handout, I have a link with different exercises that everybody can have. And so I show you 2 weight bear, because you really can't, if you're giving exercise for them to do at home, they have to be easy. We don't want things people can make a mistake or hurt themselves. So I have posture. So what's important, the strength training is very important, but equally important, we don't want anybody falling. That's how people have their injuries. So everybody, no matter what level they're at, they can do this. So strength training, even twice a week, is great. You would never do it on consecutive days, but twice a week is great. And you have to increase the weight. If you're using those 2 pounds for 5 years, that's not enough. But again, to do it safely, that's why I always say, if you can see a physical therapist, and in the United States, it's covered. And also, when people have like issues with shoulders or knees, the therapist can help you so that you're doing a safe program in good posture. So anyway, yes, we have the strength training. That's key. And that's what they mean by resistance. And it really is important, and it really makes a difference. And there's just nothing more empowering when someone can lift their suitcase and put it, I just can't tell you what I see, all these women, they thank me so much that this diagnosis was a blessing in disguise because they've gotten so strong. So, but you have to know, as a nutritionist and as a practitioner, you have to know if someone says, oh, I'm going to yoga. Okay, so let's talk about that for a minute. There are studies with yoga, but they're not really good studies when they've been looked at through a lens of, is this are they randomized controlled, and is it valid? They haven't been. I like yoga. Don't get me wrong. I happen to like yoga, but you're not getting that resistance that's necessary to really increase bone density. Right. Yes, you'll get the flexibility, and you do have to use some modifications to do it safely. So I can give you these 2 links that go into safe yoga and safe Pilates. I can share those with you. But anyway, okay. So strength training. Then we want balance, because we don't want to fall. And as we get older, if we don't use it, we lose it. And balance is something everybody can do. And that's what's so important. We don't really have fractures just out of the blue. Typically, they're from a fall. And so if we can really get ourselves in great shape and improve our balance, that's going to make a huge difference. So I'm such a big believer in Tai Chi, and there's many different balance exercises, and even strengthening your toes. They found your big toe strength can predict falls. So there's lots of exercises, but just so people start working on balance. And in that link I do some of my favorite easy balance with Tai Chi and just some easy balance exercises to get people started. And then posture. Posture is so important. If someone's sitting, we talked about that rounded position, but if someone's sitting rounded, and this is where you come in, you're working with your client. If they're sitting all slouched in a rounded position, just that position is going to put them more at risk. So they can do the posture exercises, bringing your shoulders back and down and your chin in, which That's also part of um, that link. But anyway, the point is you can, I think, make a big difference. They don't even realize, people don't realize they're sitting, all bent over. So anyway, and then, so that's the main thing. There's posture, there's balance, there's, impact. I told you about impact, and that can be, and I think aerobic is good just so that you have good cardiovascular.
So one piece in all of this, I mean, it's some key takeaways that I'm taking from this. Like, I love the 4-part. It's not just strength; it's strength, and it's strength done right. A really important thing, and you're the first person I've heard make this recommendation, is not just working with a trainer, but working with a PT. Actually, going to a PT for this. So this is not just like the random person at the gym. This is finding somebody who specializes in this. I think it's a really good point that it's probably not the only thing going on for them. Like, they've probably got some other imbalances. I'm a runner, and it's funny because people often blame running on all sorts of injuries. And I always say, no, the running isn't the problem. It's the great revealer, right, of all the things. And I think that, when, especially if you have somebody who might not have been as active, who becomes more active, it's going to be a revealer. It's going to show a bunch of other things. And working with somebody who is very specifically trained to help them navigate that makes so much sense to me. The balance piece, that makes so much sense to me. The impact. For people, particularly those who have already had some kind of injury or fracture, there's going to be a lot of fear that comes up with that. And so how do you help them kind of get them away from this kind of scared to move? If they're feeling extra fragile, they're feeling really nervous about this, especially somebody who doesn't, is not somebody who's been a lifelong exerciser. How do you help them move through that piece?
So someone who's had actually osteoporosis fracture from like the spine or the hip. Yeah. So I think they have to have a comprehensive treatment. Once you've had a fracture, this is one time where typically I usually do, the architecture, something has happened. It's called a fragility fracture. If you're like at standing height and you fall versus you've been thrown down the stairs.
Right.
So sometimes it's because of a reason that anybody would fracture, but sometimes the fact that you fracture puts you at much higher risk for further fractures. So it's something that really is a red flag that you need treatment and figure out what's going on. And typically most people will actually, I think, do better with the medication initially because something was wrong that caused this breakdown in microarchitecture in their bones. So they must get, they'll get on something, or they'll have, figuring out what they're going to do. So at least they're getting more protected because now there's new medications that actually build bone. So I think that helps people feel good about themselves. And that's where I think when people work with a physical therapist and they learn what actually causes the fractures, what are the movements, but immobility and resting is more of a risk factor from, because you lose more bone. So I think, and they do make certain braces if necessary, if that's going to give them there's one called the Spinomed that you can be active in. So if somebody needs that initially, I think that's where it's so good to work with the physical therapist to learn what movement's safe, what isn't, what movement would possibly cause a fracture that I should avoid. And I think that, so I think, and, you need to start slow, and we don't want overwhelm. That's really, truly the biggest enemy. So anywhere, they got a warning. Luckily, they're okay.
Yeah.
And let's start building up your bone and doing the whole thing with everything, who knows what's going on in their gut, the whole entire treatment. And then, getting themselves strong, better balance so it doesn't happen again. So I think, when you change the lens of how they're looking at it, that we need to do all this so it doesn't happen again. And and people do fine, they certainly can improve.
You mentioned something that I think can be controversial in this, and I just want to dig into it right now, which is medication, right? Sometimes there's this sense that, or kind of a belief in particularly the functional community, that doctors are quick to prescribe and that's not warranted. Talk to me about your thoughts on medication and how our practitioners should be thinking about this when a client comes, if they've been on medication or considering going on medication. Is there a time and a place, or is this one of those like, no, we can do this naturally and there's no rule?
I'm so happy you asked this question because my very first summit, I've had 4. My very first summit, it's called Natural Approaches to Osteoporosis and Bone Health. And I was always so annoyed because that is in medicine, if you have, a certain minus 2.5, that's it. Medication, vitamin D and calcium and exercise, out the door. And that is true. That is true. That is the treatment. And that's the belief that, you can only get better on medication. Okay. That being said, so I just didn't even bring it up. I thought, I didn't want to alienate conventional doctors. So I sort of said, let's just talk about other approaches. And I realized that was a huge mistake because just like you said, people are like, no, there's so many side effects. I don't want to deal with medication. Well, the problem with osteoporosis is that a fracture is very debilitating. And so there are situations, and once you have one fracture, you really are 25% of people will die within that year of a fracture. Another 25% will end up in a nursing home. So it's very common. 50% of women will have a fracture due to osteoporosis in their lifetime. So this is huge. And the problem is that there are too many people that are like, no, under no circumstances am I taking medication. And then they have a fracture. This just happened. Someone just recently told me the story. And, so my feeling on the medication is it can be used as part of a comprehensive integrative approach. So if you have very low bone density, you're at very high risk. There are now medications that actually build bone, that actually increase the architecture. You don't stay on them forever. It's 1 to 2 years. And then you go on but you can't just stop it. There's a certain sequence. But the point is, people have done amazing. So they build up their bone while this is what's a little missing from the conventional world, but not in the integrative world, while they're figuring out the root causes. What's their gut? What's the inflammation? What's going on? What are their hormones? All the other things. We need those pieces. So while they're doing that, at least they're protected. So they're building new bone now. They're not going to be at risk. Figuring out, and then I don't believe people have to stay on it forever. But so I think there really is, and this is from a person who's not into medication. I'm the last person, but in this situation, it is so debilitating a fracture. So if you tell a patient, no, we'll try it naturally, and they have very low bone density, and the bone density, you can tell from the bone density, the DEXA, you get that, but there's also, it's called the trabecular bone score. TBS. Highly, highly recommend. And it's going to become even easier. And they have newer versions of this. But what it is it's software that a lot of DEXAs have that can tell you bone quality. And that's so important because it really matters. 2 people, one can be eating the worst diet or, not have any protein, whatever. And their bones, the quality is so poor that if they fall, they'll fracture, where someone else with the same exact bone density has the quality of their bone is really good. So that's why I always recommend if people can get the TBS, it's so very helpful.
And that's just an add-on to the DEXA? Or
Yes,
if you're getting your DEXA scan, you can ask to have that.
So what you have to do is there is a I can give it to you. I don't know it offhand, but there is a link and that you put in your zip code and you can find out where the TBS, where they have one near you. And I would just call the facility to make sure, but it makes such a difference. It gives you so much more information because if let's say someone's 50 and they get their first bone density and it shows it's low, we don't know what's going on. We don't know. Are they actively losing bone? Is something happening? Or just as a kid, maybe they had anorexia or they didn't eat, they didn't develop as much bone. So this can, it tells you the quality, but there's even other tests that can say what's happening. But anyway, so my feeling on medication is it's something I think as someone working, as a practitioner, as a nutritionist or whatever, or as a health coach, however you're working with the person, is that your place is not to say, oh, don't take medicine, let's do all these other things. I think this is a situation where depending on where their bone density is, depending on had they had a fracture. If they've had a fracture, typically something's going on. And most of the integrative doctors who I work with all feel in that situation, it's a good idea for a short term to go on medication, build up your bone. And while you're figuring out everything, while you're doing an exercise program, while you're doing the eating and reducing, all the things that would go into a program. But this is very different than other situations where, someone has like diabetes, we're going to maybe do diet first and not worry about things. Where in this situation, if someone's really at risk for a fracture, it's just so sad. It really, you just want to prevent that. So I think there is a role, but very interesting. It's different than other places where, like in other conditions, maybe they'll do the least aggressive medication first,
Right.
and then they build up. Not with osteoporosis. If someone is, really at high risk for fall, the order matters. So if you go on what's called the bisphosphonate, where it blocks, it reduces like the breakdown of bone, and that would be Fosamax, Actonel, Reclast. If you go on that first, and then you go on one of the bone building medications, which would be like Tymlos, Forteo, or Evenity, if you go on one of the bone building, it blunts the effect. So it's not nearly as effective. So you want to go on. Anyway, you'd want to work with someone. I'm not going to get into that whole discussion. But you'd want to work with someone. But I think the main thing is, I think you're doing someone a disservice if you say to them, no, let's try this naturally, and then they have a fall and a fracture. I've just been in the field too much and realized that there is a place, and the medications short term are not having those horrible side effects. Short term, where they're being monitored, and then figuring out, but they just can't stop them either. So there's like a taper down, and there's a whole way to do things. So anyway, I think I think there is a place, not for everybody, of course, but there for certain people who are at higher risk, I think it can really help.
Hey practitioners, can we have an honest chat about fertility cases for a minute? When a client walks in and says they're trying to conceive, do you feel confident or a little unsure about what to do next? Let's be real. Even with advanced training and clinical tools, fertility cases can be some of the toughest ones that you'll face. There is so much going on beneath the surface, and when your clients aren't getting the results they want, it's hard not to wonder if you're missing something. Here at Restorative Wellness Solutions, we want to make sure you feel 100% confident and well-equipped to help every single fertility case that walks through your door. That's why we're inviting you to join us for a free 3-part live fertility masterclass series where we'll walk you through how to tackle even the most complex cases step by step. We're covering everything from laying solid nutritional foundations to figuring out which tests to run to using simple sex-specific tools that help your clients get better results. Whether you're brand new to fertility or you're looking to go deeper, this series will give you a practical clinical framework that you can start putting into practice right away. So don't wait. Head to the show notes, click the link for Precision Nutrition for Fertility, and grab your free spot now. You and your clients will be so grateful that you did. That's really, really important. So I think that's fantastic information, because I think it can be really easy to kind of write that off. And also knowing that it's temporary. It's not for the rest of time, right? And as you're doing this deeper digging, just for those of you listening, I see Tiffany found the link to the places that have the
great.
EPS. So it's Medimaps, MEDIMAPS.AI/find-centers-with-TBS. I think if you look up Medimass and TBS, you'll figure it out. So that's awesome. Such a great tip there.
And supposedly it's more, it's funny, I was just at a conference in DC, the Bone Health, the Interdisciplinary Symposium on Osteoporosis, and the company was there. And because I said it's hard for people sometimes to get, and they're saying we're getting way more units. It's covered by insurance for the most part. And and then we even have newer versions. So good things are happening with the TBS, and the research is very positive also.
I love it. So let's talk more about some of these root causes. You've alluded to them. You've alluded to gut, hormones. I know a lot of people, particularly our clients, when they come, they just sort of write it off as inevitable and due to aging. What I would love to hear from you is, from that clinical lens, what underlying contributors do you think are the most under-recognized? So thinking of those things that people tend to overlook or just gloss over.
Okay. So I think what's really overlooked, I think the gut, I have to be honest with you, unless it's a serious gut issue. People know Crohn's and they know and they know celiac. They'll know celiac. That's well accepted. If you test positive, the doctors will all test for celiac, but that is it. They go no further with gluten. And that always has driven me crazy. I see that as I see this all the time. People who have issues with gluten and regardless of what it is, it's just, inflammatory, whether it's autoimmune. But so many people have gone off gluten and their bone density increased, and I know all of you, I'm preaching to the choir here, and their arthritis improved. I mean, it's unbelievable. So I see gluten sensitivity, wheat sensitivity, or not celiac. That's well accepted. But any other gluten issue or autoimmune issue, I just see a lot of times they don't pay any attention to that. And really just anything that causes inflammation, I see. People just don't seem to, or homocysteine levels, people don't seem to really make that connection that the bones are not separate from the body, and we all know it all works. That's why I love this community with the integrative lens. But with, so anything that's causing inflammation in the body can also cause inflammation and increase the osteoclast, the cells to break down bone. So I think different chronic inflammation is not seen a lot as well. The other thing that I want to really share, and this has been unbelievable to me. So when people get their blood work, they get a blood calcium value.
Yep.
And it doesn't differentiate between the age. So there's like one value, whether you're in the green or the red. And the truth is it shouldn't be that way. So when there's numbers, anyone who is 40 or over should be in the 9s. Anybody in the 10s on this blood calcium has a very high risk of hyperparathyroid, which is a tumor, parathyroid tumor. And, which is when that's activated, that's causing too much calcium to be taken out of your bones. So I had a Dr. Diva Boone is a parathyroid surgeon on my summit, and she gave everybody the numbers. And each time, 20 people, each summit, 20, not making this up, 20 people found out they had hyperparathyroidism. And what it is, it's a surgery, but very effective. It's like a cure for this problem. And, you have to go to the right surgeon, but it's benign tumors, but it's unbelievable. So I think this is really missed too often. Yeah. And I mean, there's so many people that wrote me thank you notes. Oh my gosh, I had no idea. And, they're thriving now because this was, it's like unexplained. Like, why am I losing so much bone? But the thing is, it's so interesting is that the doctors, and I know this from my husband, he's an OBGYN, the doctors in med school don't learn that, let's watch it if it's a little high. Yeah. Dr. Boone says that's not the case. You really need to get it checked out. And you can look her up, Dr. Diva Boone. She's I think it's called Southwest Parathyroid. But if you Google her, on her website, she has a calculator where you put in the parathyroid hormone and you PTH and you put in your blood calcium. And sometimes, it could be from too much vitamin D or calcium, but typically it's not. And it's just something that I think all of you could pick up and, and hear this person's losing all this bone. So I see that. Can you imagine 20 people each summit? I've had 4 summits. My husband had a person 40 years old and she had I think it was 10.1, where normally he would have said, oh, let's watch this. But he knew, he watched, he learned. And sure enough, that age, 40, she had a tumor. And that could have caused so many problems in her life. A lot of times it can cause fatigue, other things. But so anyway, so I think that's overlooked. And I think the last thing I would just mention is blood sugar. That even someone who's pre-diabetic, they found anybody 5.7 and above with A1C has a 25% increased risk of fractures. That's huge. So wow. Anyway, yeah. So I'd say those are some of the underlooked. Most people know about hormones, and with menopause, there's a huge, that's when women can lose bones. But to me, that's also an opportunity where we can intervene and prevent. but that's well known. You asked me what are the ones that I see that really aren't so known.
I love it. And one of them that you mentioned in passing, and I'd love you to help us make that connection,
Yeah.
is the homocysteine levels.
Yeah.
So can you help us make the connection to, I'm assuming you're meaning elevated homocysteine
Yeah,
levels and
elevated
blood specific.
homocysteine. It really affects the bone. It really affects how brittle the bone is, and it really affects. And so, yeah, they've have some studies showing correlation. So it's interesting. I mean, I'm trying to think of the exact level, but really most of the functional medicine people like it to be like 8 or under.
Yeah,
I think if it's over 12 or 15, there's I don't remember the exact number for studies, but they really showed an increase in reduction in bone density and increase in fractures. So
wow.
it's a good thing to monitor and see. And a lot of times it just can be corrected with folate and vitamin B and different things. But it's something that I think is important when people are getting checked out to see their homocysteine levels.
As a happiness coach, how do you recommend people evaluate this mindset piece, like thinking about sort of their emotional health, the stress levels you mentioned, very high cortisol levels correlated with issues. How do you recommend practitioners be thinking about that and addressing that with their clients?
I love that question because this is what if I would have to say what my favorite thing is doing is that I think there's many, many things. I mean, I teach a whole happiness class. And so I think, you figure out what works in your toolbox. What are the tools that are most effective for you and you found with your clients? So I think in terms of happiness, I think the key thing is getting the person out of the poor me victim. I think, and so many people, oh, poor me, I'm going to fall and fracture. And, you can just get that whole narrative and nobody, I mean, this is what I found as a physical therapist, nobody heals, when they're in that state in victimhood. So we need to, instead of focusing on what the problem is, focus on what are your solutions and not let the person, oh, I'm feeling miserable today. They walk in, okay, so what wins do you have or what's happened good, but in terms of focusing on solutions. Okay, so someone has osteoporosis. Yeah, we could like sit and do a pity party versus we can, okay, so we're going to build we're going to do great things that you're going to feel stronger and whatever it is. Or when we work on the gut, oh my God, right? You know better than anyone how much better people feel. You're going to sleep better. You're going to have more energy. So making it as though that this is a blessing in disguise because everything that you do, and a lot of times they haven't had any fractures, they just get this DEXA test and it's all of a sudden they get this whole negative image. It conjures up fear. So instead we try to conjure up empowerment. Okay, what are you going to do? And so, so I think in terms of focusing on solutions and giving them, steps to take and how great, and also when you start doing and step at a time. Oh, you can't do overwhelm. So even if it's one thing, if they, and I just, with the exercise, walking is not enough. People are like, oh, I'm walking 5 miles a day. Not enough when it comes to the bones. And sure, walking is always good, but that's, you need to tell people they need to do more than that. So I think in terms of the mindset, focusing on solutions, number one, and then what's good. We have to get rid of that 80% of our thoughts are negative. The negativity just pours over us. And so instead of focusing on what's, like when you wake up in the morning, what's good? What good is here I can't see? And really start being like a detective for the good. And then when something good happens, really make a big deal and really celebrate it. And we'll start rewiring, your brain for more positivity. So there's many, and community. Community is so important if people are doing, that's why I have a community and I just love it because we all support each other. But I think find a community, that so that you're not by yourself doing this. And so there's lots of different things, but I think it's important. And then whatever stress reduction you like, whether it's just breathing, that's the first thing I teach people. The first thing is before they eat to just take some nice deep belly breaths, so they're not breathing from the chest. But that's so powerful because It calms them down. Research has shown when you pair an activity with something you're already doing, so we're all eating, you're going to do it. If I just said breathe during the day, they may not.
Right.
And then when you slow down, you know how this is going to affect your digestion, and all of you know that. But so that's where I just start something easy. Before you eat, let's take some 4 deep breaths or whatever. So anyway, there's lots of different tools in terms of stress reduction, and I think figure out journaling. Journaling's amazing. Whatever the person, everyone's so individual, but what works for them.
Right.
So I think it's just making it, I think the big key is to let them know that this is a priority, because people come to me and they're so worried. Oh my gosh, am I doing the right exercise? Am I eating the right food? Am I taking the right supplements? That they don't realize that this stress itself is a risk factor. And that's what I tell them. And I always I got a speeding ticket. I've always been happy, but I have to say my mother was very type A, and being relaxed is not in my natural way at all. And so I got a speeding ticket to an 8-week mindfulness meditation program. And that was like the best thing that ever happened to me, because it hit me in the head that you are not authentic. You are not practicing what you preach. And I took this class like my life depended on it.
Right.
And, but it was the best thing, because now I've made that such a priority in my life, and it just changes. You go with the flow. Life's not easy. You can't change. There'll be stresses. But if you can change yourself, anyway, yeah.
I love it. I love it. You have a 4-step process, and we've probably touched on pieces of this for preventing and then treating or reversing osteoporosis. So what I'd love you to do is, can you walk us through that 4-step process? And as we go, can you highlight those areas that you see practitioners most commonly miss the mark, or just skip altogether, or kind of get it wrong?
Sure. So the first step is the evaluation piece. And that's, it's not one size fits all when it comes to osteoporosis. And that's the big thing. That's why, when you get a DEXA and they just say, and they send you off medication, vitamin D and calcium and exercise, there's so many reasons. So I think a really good evaluation is important. And 2 tests that I think are missing a lot, that I think are really key in the evaluation process, there's something called the CTX. I'm not going to go into the whole long name. It's hard to say. And P1MP. And what so you get this DEXA, right? And we don't know what that score means. They compare your bones to a 30-year-old and standard deviations away. So it just says, okay, mine is 2.5 or lower is osteoporosis. But as I said earlier, we don't know. Is someone actively losing bone, or did they just never develop it as a kid? And so there's a CTX, which measures these osteoclasts, the cells that actually break down bone. And so it's such a good test, because we can see if you have really high levels, something's going on that's causing inflammation, that's causing your, bone breakdown. And we have a good baseline. And then the P1MP shows the osteoblast, the bone building cells. So I think those tests really help. But I think the evaluation, we need, just like you do. This is something that, all of you are just so wonderful at in the work you do. I know, Margaret, what you do is amazing. And so, I don't think you miss these things, but in terms, I think just really looking at underlying root causes, what could be going on, autoimmune issues, thyroid issues, everything in terms of hormones, or does this person have cortisol through the roof? There's so many different things. And even medications, people are on, sometimes they're on the corticosteroids, or there's a lot of medications that can cause bone loss too. Even, people for their gut are on the proton pump inhibitors. That's a huge one where people, even some of the antidepressants too. So the point is, I think a very good evaluation and to see what may be the underlying root causes is so important. We talked about blood sugar, and we talked about, so I think that's a piece. And I do see that, especially in conventional medicine, this is really missing. So that's one. The second part is nutrition and supplements, and to really see where a person's at, where they may be lacking, and I think that's, so step one, So step one is evaluation. And step two, then there's three parts to it. They all sort of go together then that I think, matter. So in terms of, really optimizing nutrition and really optimizing, and diet. And where I see it go, when I see as people get older, I don't think they appreciate the protein. I see that there's just not enough protein that adults are getting. And I don't think it's really talked about as much as it should be. And that's that, and sometimes I'll do micronutrient testing or whatever, but you need to figure out what, and this is where I know all of you are really great at, but this is a very, very important piece in terms of supplementing. And in terms of the supplements that I see are missing, when I see people get it wrong, too much calcium.
Right.
So, it used to be, they said 1,200 milligrams, but unfortunately there have been meta-analysis now that show there was one meta-analysis, very large in 2021 that was done. And they showed that supplements above 1,000 and even food between 700 to 1,000 milligrams increase 15% cardiovascular disease.
Yeah.
15%. So now people are saying more the integrative, around 800. That's a safe amount, and they'll be protective of your bone without causing any cardiac. So I see a lot of times practitioners will just, or especially, this is more physicians, will say, okay, 1,200. Or they'll give, tell them to take high dose of calcium, yet they're getting it in their diet. Right. So I think that's so important, the calcium. And I think also the oxalates people need to be aware of. Oftentimes, they'll be eating spinach because they see spinach has high calcium content. So, not to have the oxalate foods in. And then the other thing I said with supplements, I love magnesium, but the one that's missing too often that I think is so important is vitamin K2 in terms of making sure the calcium gets into the bones, not the soft tissue. And so anyway, so we want to make sure the nutrition that's so important. And, the collagen matrix and just for the bones. And then 3 is exercise, to critical. And, I just see people really increase their bone density with exercise. I see it more and more, and it's so exciting. But even if they maintain, that's still good, because as you age, people gradually decrease. And then the 4th is the stress and the happiness for me. I think that piece is so important. And, it's really funny because I also have a membership, and, people just, and I also have a happiness program, and people just, the bones people, no one ever enrolled in the happiness program. Like, they wouldn't even consider it. So I just put it in the membership because I just think it's so important. So they come, but it's not something anybody values. It's always so amazing to me that the average person, oh, come on, they just sort of don't realize how powerful it is. So those are the basic components of what I think works. And, I know it works, the integrative approach, because I've been doing this for 25 years. I work with Dr. Kim Millman a lot. We're doing actually a practitioner program, but she's been 15 years, and there are very few doctors who have been working with osteoporosis in an integrative approach, root cause, figuring, working on all these things for so long. And she's had amazing results, almost, such a low fracture rate, and really people have done incredible. And it works. It really works. And people turn that fear into empowerment. And that's to me, the best thing, because when you're working on your bones and your gut and everything, like, your life really does get better. So it ends up being a win-win.
I don't know if I ever shared this with you, but my mom had a lot of different health issues, and she did have pretty severe osteoporosis as well. And I remember when I was in my 30s, I did the DEXA scan for the first time. It was when it was just becoming kind of popularized, and it was, I was doing it more for body composition. I kind of couldn't care about the bone health thing because I was in my mid-30s. I didn't think I needed to think about it. And I remember when I got those results, and I was osteopenic, and I was like, wait, what? And I was already a nutrition professional, and I was shocked. And now I will admit, I was also, I got pregnant a few months later, had my kid, like I just sort of like life happened. And what's really interesting is that I inadvertently did a lot of the things that we're talking about here, right? Like I have always been a distance runner, but I was terrible about the weight training, right? And so I really built in weight training at a certain point. And then I was way more responsible with my supplementation, even things like I'd always been good about vitamin D, but I started building in the vitamin K as well. And I was just started eating pharma protein, which I used to be horrible about consuming enough protein. Like there was just, I did a bunch of gut healing at a certain point. Like I did all of these things, not in any way thinking about the bone health. I was doing these things as like part of, what we do to take care of ourselves. And as we learn more, and as I dove deeper into the functional health world. And then I did a DEXA scan. Again, I kept thinking, oh, I got to get that done again. I got to get that done again. And I just got it done when we first moved to Boston. So I was 49 years old. So that was, 12, 13 years later. And it was night and day, like just complete. There was not a hint of osteopenia. Like everything was completely fine. And I remember thinking like, oh, look at that. I just completely reversed this. And now I am thinking about bone health, right? Like, of course I still care about body composition, but now bone health was actually very front and center. And so this
Wow. I love that. It really does work. And
really
that's such a good example of where all the nutritionists can help people at any age, because it's going to affect your bones at any age. Just like you said, people don't even realize that. Yeah. Wow.
You just gave us a little tease and said that you have a practitioner program coming. Can you tell us a little bit about it?
It's very interesting because I saw Dr. Kim Millman and I have been doing this program called Restore and Rebuild. What is it? 100 Days to Stronger Bones that we do together. And she, as a physician, is so packed. Oh my gosh. I mean, she has such a waiting list. I don't see people one-on-one because I'm so busy doing programs and doing education, but there are so many people who need this information and it's not out there. And so we decided that wouldn't it be like, what's the best way to educate people and who can really make a difference? So it's the nutrition practitioners, really, because you really need that background. You need the nutrition. You know what I mean? Physical therapists don't have that background without anyway. So we thought, you know what? We could train people on what Dr. Millman has been doing, because she has a method, exactly what testing, exactly what is work, what tests do we need, what supplements do we do, what's worked with this, what's worked, proven. And she's put together all sorts of done for you sheets on how to evaluate your calcium, how to figure out oxalates, how to test for this, how to test for that. And then I have all the exercise things. So anyway, so we decided, wouldn't this be incredible if we could create a certification? And also we get asked all the time for referrals, and this way we would have people that we knew. Oh, whoops, got so excited. I'm knocking over my mic. That we would know have this knowledge so we can refer to them, because we both, between the two of us, we have so many people, oh my gosh, who just want to work with someone who's knowledgeable and understands this integrative approach. Anyway, so yes, so we're going to be starting in September actually. And our first cohort, which I think will be really good because we'll have so much, one-on-one time with them. And we're really going to work with the people. We're not taking that many people. We're really going to work with people and make sure, there'll be, we'll be evaluating everybody beforehand to making sure they have the right credentials. But I think the nutritionists, especially the nutritionists who you have taught, that's exactly what we're looking for. People who have this incredible background to start with is incredible. So yeah, if anybody's interested, I don't have the link quite yet, but what I will do, I will get that to you, Margaret, in terms of, because we're thinking of having a webinar in July, also on testing, on how you can do, because Dr. Millman has some really great, some tools that she's put together for testing. But also if you opt in to get the exercises for your clients, I'll have your name. And as soon as I know more details about it, because we've been working on it for a while, but we're just working on the finishing touches of it. And we've been teaching this class now for years, and so many people have benefited and, really been able to use the functional labs and figure out what to do. And it's just been, that we realized it can be done. People can, there's only one of her, only one of me, but there's the need is out there, and we just want a whole army of people that can help us, really, really get the message out with the tools, with the
Right.
tools. And, and again, then we can work with us, that we can say, okay. And a lot of the people also that we see want coaches. They can't do this alone. It's hard.
Right.
And so they want someone who's going to step by step, but who has the knowledge. And so, we get these requests all the time. So, that's so the people who've taken the program will be perfect. We have all these different people to, because we have so many people who are asking for this, that we said, you know what? We're just going to create this and give people the tools so anyway, so I'm really excited about it. And, I think
That's fantastic. Well, what we'll do is we have a link here. Let's make sure, Julie, if you could pop that link into the chat for those who are watching live so they can jump on and get those bone exercises and then get on your list. So they'll be alerted. And then we'll make sure that link will go into the show notes when we push this live as a podcast. And definitely keep us in the loop as to when you're going to be doing those webinars, as I'm sure our community would. I mean, our philosophies, as we've discovered in conversations and interviews, our philosophies really work together so powerfully.
Exactly.
I hope everybody here was listening to one of the most overlooked and important pieces is the gut. This is one reason, number 872, why we always start with the gut. There's just so much that we can do there. So
we do too. That's our program. The first thing Dr. Millman says is the first place to start is the gut. So but the truth is, I just have to say that these people are so appreciative, and it can make such a difference. That's what excites me, that I really believe we can change. We're the people. It's not, I mean, yes, the doctors can help, but I think it's the integrator and the nutritionists and who really can move the needle and really change lives. And people thank me all the time. Maybe because people learned about you, Margaret, from the summit. Thank you so much for introducing me. I had no idea. And people, because they don't have this knowledge, and even people from other countries, that's what also is interesting. In other countries, they don't have what they have here. And people are thanking me so much. They didn't realize this, so it's very rewarding. And, when you can prevent someone from having a fracture, you've completely changed their life. So it's really exciting.
So I'm going to say, anyone in here, if you specialize in working with an older population, women going through menopause, and anyone who is really thinking about this, I'm going to strongly recommend. I think this is quite an opportunity for folks to work with you in the first time through. Having been the person who's gone in a couple of cases through different programs, actually Restorative Wellness Solutions, I was in that very, very first class. And it's not an accident that I'm sitting in front of you here today. That is the way to get in on the ground. You get the one-on-one, you get the really as they're working it out. So I'm going to really strongly recommend those who are thinking of focusing in this area. This is an amazing opportunity. And as you can see, Margie is an absolute delight. So freaking knowledgeable. I mean, you're just like an encyclopedia of this. So
if you think I know this, Dr. Kim Millman is, yes, I know a lot, but honestly, she is a walking, she's just an integrative doctor who knows everything. And she works, so she's, she puts me to shame in terms of how much I know. But the point is, the thing is, we're going to have so many Q&As where we work with you with patients, so that you'll really understand the methods and really get, have a very different approach than the rest of the world, because it isn't out there. This just is not out there, unfortunately. And it needs to be.
Margie, thank you for joining us today and sharing all your wisdom. And thank you for doing what you do. It's so important. And there's not enough people talking about this. And you do it in such a compelling and accessible way. It's just, you're awesome.
Well, thank you for having me. Same to you. I'm always so impressed every time we're together, and just the work that you do and what you've done with, teaching others and really spreading it. I guess that's an inspiration to me too, because I know what you've done with your school and how many people's lives have been changed from all the work all of you are doing. So that sort of excites me that, can do that also in a different way. But yes, thank you. So thank you so much for letting me come today and share all this important information.
So wonderful. Thank you, everybody who's with us live, and those of us listening later on the podcast. Have a wonderful rest of your day.